Welcome to another Providence St. Joseph Health Training video. Today's presentation features a brief review of wound care in the home environment. The objectives of this learning module are: demonstrate best practice wound care setup in the home, demonstrate excellent infection control during wound care in the home, achieve zero harm to patients when performing wound care in the home. The following is a visual demonstration of best practice wound care in the home. Step 1. Confirm the order. For this patient scenario, the wound care order states: wound treatment for left hip pressure ulcer. Cleanse the wound with wound cleanser. Pat dry with gauze. Cover wound bed with Max Zorb Extra Alginate wound dressing. Cover with secondary absorbent dressing Optifoam. Secure with transparent dressing if needed. Change every other day. May change if dressing becomes soiled or loosened. May discontinue wound care treatment when wound heals. Step 2. Gather supplies. Supplies will be available in the patient home or secured from your clinician bag or trunk stock. Gather your supplies per the order and place on the barrier you have prepared. For this patient, you will need the following: hand sanitizer, gloves, wound care cleanser and 4x4 gauze, Optifoam secondary dressing, Max Zorb Extra Alginate wound dressing, the optional transparent dressing, and a small trash receptacle. Remember, if you are obtaining supplies from your bag, you will need to perform hand hygiene before entering the bag. Additional items obtained from the clinician's bag include a measuring device. For this patient, we will use a cotton-tipped swab so we can measure depth as well as length and width, alcohol swabs, and scissors. The cotton-tipped swab package may double as a patient identifier for wound photos. Be sure to include patient name, medical record number, location of the wound, and date the photo was taken. Step 3. Perform the wound care. The clinician performs hand hygiene before donning the first pair of gloves. The clinician removes the old dressing and, after inspecting the dressing for drainage, disposes of it. The gloves are removed at this time, and hand hygiene is performed again before donning clean gloves. Now the clinician is prepared to clean the wound. After the clinician has cleaned the wound, now is a good time to collect wound measurements. Use the cotton-tipped applicator package with the measurement or the paper measuring tape. Before using the scissors, the clinician must clean them with alcohol. She also allows time for the alcohol to dry. The gloves are removed and disposed of, and hand hygiene is performed. The clinician then replaces the items that are remaining into the patient's supply box. The leftover bulk gauze is not returned to its original packaging. Instead, it is placed in a clean baggie and sealed and placed away for future use. The scissors are once again cleaned with alcohol. The alcohol is allowed to dry before the scissors are placed in their original container for safekeeping until the next visit. The barrier is removed and disposed of, and the clinician performs hand hygiene, concluding the wound care treatment. These final short clips demonstrate tips for best practice for wound care. Best practice tip number 1. Never enter your clinician bag without performing hand hygiene. If you are in the middle of your wound treatment and realize you have forgotten an item, you must first remove your gloves, perform hand hygiene, and then enter the bag or box of supplies for the required items. Best practice tip number 2. Do not cross the wound care field when performing dressing change. Notice how the clinician crosses the wound care field with the dirty dressing. Instead, the clinician should avoid crossing the wound care field. Best practice tip number 3. Never return unused bulk gauze to the original package. You may place it in a separate baggie as long as it is not contaminated for use at a future visit. But if in doubt, throw it out. Best practice tip number 4. Opened saline must be stored in the refrigerator and may be used for up to 7 days. The container should be properly labeled with the date opened and initials. This container is not properly labeled and must be disposed of. A new container is obtained and properly labeled. Allow the solution to come to room temperature before applying to the new tissue growth, as cold solutions can inhibit new granulation for up to 16 hours. If the order requires irrigating the wound using a syringe, pour the irrigation solution into a clean specimen cup. Withdraw the required amount into a syringe. Be careful not to allow the syringe to rest in the cup. Rest the syringe on the lid. Once you have completed your treatment, dispose of the solution and replace the cap. Place the syringe in a clean baggie or original packaging for safekeeping until the next treatment. The cup and syringe should also be dated and are good for 7 days as well. Best practice tip number 5. If there are multiple wounds, the clinician must treat each wound independently to avoid cross-contamination. This includes using a new measuring device for each wound. Paper tapes can be torn so that you have multiple measuring devices if you have multiple wounds. In summary, let's briefly review the 3 steps and 5 tips. Step 1. Confirm the order. Step 2. Gather the supplies. Step 3. Perform the wound care for each wound. Tip 1. Always perform hand hygiene before entering your bag. Tip 2. Maintain a clean work area throughout the care. Tip 3. Do not return unused bulk supplies to the containers. Tip 4. Know the requirements for cleaning solution storage and maintaining irrigation supplies. Tip 5. Avoid cross-contamination of wounds by treating each independently. This concludes our brief learning module on wound care in the home. Thank you for watching.